Hello there. Welcome to another video. In this video we are going to learn about OET format along with the score. Now let's go to first part, that is OET format. The OET consists of 4 main subtests: listening, reading, writing, and speaking. Each section assesses professional language skills in a healthcare context using different formats and timings. Now, let us go to listening section. The total time duration for the listening is approximately 45 minutes. There will be altogether 42 questions in listening section. The listening section is divided into 3 parts called as Part A, Part B, and Part C. Part A comprises of consultation extracts, which includes conversation like health professional patient consultations. Next one is Part B, which includes short workplace extracts such as briefings, handovers, etc. The last part of listening is Part C, which includes presentation extracts like healthcare topic presentations or interviews. And the audio will be played once only. So, candidates listen to recordings once and answer the questions. Since we are done with listening part, now let us move to the next section of OET test, the reading section. The total time duration for reading in OET test is 60 minutes. And the total number of questions is 42 questions. OET reading has 3 parts: Part A, Part B, and Part C. Let's jump to Part A. Part A consists of expeditious reading where we have to skim through the 4 short texts for information. Whereas, Part B requires a careful reading from the short text which will be on the workplace topics. The final part is Part C, which is again focused on careful reading to find out the detailed meaning in longer texts. One more thing, the topics in OET reading are related to general healthcare contexts. Now the third section is writing. The total time duration for writing is 40 to 45 minutes. Here you have to write down a letter as per the medical scenario. The structure of the letter depends on the profession. Here, the candidates must write a letter, e.g., referral, discharge, advice, based on clinical case notes. The letter is assessed on criteria such as purpose, clarity, content, organization, and language. Now the final section of OET is speaking. The total time duration for the speaking is 20 minutes. The OET speaking test includes 2 role-play scenarios which are again profession-specific. Here the candidate acts their professional role in simulated workplace situations. For example, if the candidate is a doctor, then in speaking exam he will act as a doctor and will speak on the scenario as per the condition given in the role-play card. Furthermore, the candidate is evaluated on the basis of both linguistic and clinical communication skills, for example, relationship building, information giving or gathering, fluency, grammar, and so on. We have learned about the 4 sections of OET. The summarized format in table form is shown here. Now let us talk about the OET scores. Scores in OET are given on a scale from 0 to 500. And also scores are mapped to grades from A to E, with A being the highest and E being the lowest. OET is widely accepted for healthcare professionals aiming to work or study in English-speaking environments.